You know, there's a big difference between getting sober and living sober, and it's the living sober that we care about. We have this fabulous campus now that people have options and they can come back for a tune-up in one form or another. And I think that's very important in the recovery world, and we're just so excited about that. And our recovery living, I love that word because that really is, it's about how to learn to live in recovery. So what we want to do is we want to put in our little arsenal of tricks every possible modality that we can help our patients with. So what does that look like? That's our residential program, that's our intensive outpatient program, that's our recovery living, it's our alumni, and it's our telehealth, because people move out of the area and we want them to stay connected.
So as they're inpatient, I'm talking to them and we're letting them know, Recovery Ways has these programs, and as you progress and as you can continue, we're still there. And so these are some of the alumni activities that we do. Here's our weekly ones. Here's our, the ones that we do on a quarterly. We want you coming. We want you engaged. We'll call you. Stay connected with us. And as we do that, you see that can reduce some of their anxiety. And they're just like, okay, there's going to be some support here.
The primary benefits we see for a telehealth program is patients who normally would not have access to continuing care now have access wherever they are. It's cost-effective treatment. They don't have to give up work for 6 or 7 or 8 weeks to participate in a program. It's private. They can do it in the comforts of environment that they choose, and it still keeps the personal connection as if they were in treatment.
We believe in reintegration, and what that means is that they go out and they can find a job, or they can go to school, or they get reunited with their families, because that really is what Freedom for Life means to us.
What really motivates them to want to come and be connected with the alumni and to participate, we have the sober softball, we have the sober volleyball that we do, as well as I've done individual climbing groups and other things that they're interested in. And they kind of catch the spirit when they're inpatient and they want to continue with it. So they're motivated to come because they're going to know they're going to be with people who they're familiar with, who are in recovery, who understand them and know where they're coming from. And then on the other side of it, it's their passion. They're coming because these are things that they've rediscovered about themselves and that they love. And they're excited to be able to keep exploring and keep learning and being productive in that manner.
We're in a world now where technology has been able to combine with medicine, and we see it in other disciplines. It's also in the recovery field now, and with the advances of technology combining with behavioral health medicine, Joint Commissioned accreditation, it's bringing telehealth to the forefront, and we are one of the leaders in telehealth in this country.
Recovery Ways is a recovery management model. It's a continuum of care, and what matters in that continuum of care is that we help our patients maintain their sobriety for however long it takes, for forever. That's what we believe in. That's what recovery management is all about.
This is going to be here for them, not just today, not just next week, but we're going to be here for months. We're going to be here for years. And we're always here whenever they choose to use us, and we're going to continue to reach out.
Healing from addiction means just that, the ability to stay free of the alcohol and drugs. And Freedom for Life, what that means is creating that beautiful life that everyone deserves.